To manage the COVID-19 pandemic, long-term care homes have had to restrict access to essential visitors only. While the restrictions are designed to protect the health and safety of residents, staff, and the community, they also effectively isolate residents from their family and friends. To minimize this isolation, some long-term care homes have adopted video conferencing and other technologies.
I belong to True Amateur Radio Club here in Ottawa. Through amateur radio and the COVID restrictions, we've been keeping in touch via Zoom. It's been more fun attending meetings via Zoom because you get the greater attendance, and the people who are willing to give us presentation are always more than willing to participate via Zoom.
With Canadians living longer and more likely to suffer from chronic disease, demand for long-term care continues to increase. Technology can help manage some of the problems associated with aging and chronic disease, which supports our healthcare system and older adults living in long-term care. During the pandemic, technologies such as virtual visits and telemedicine have helped improve the quality of life experienced by residents in some long-term care homes. When implemented too quickly or without proper planning, however, technology can disrupt care and lead to errors that diminish quality of life, waste resources, and frustrate long-term care staff. But which technologies are best, and how should they be implemented? Managers, who tend to know much more about caring for residents and managing a long-term care home than they do about technology, are poorly placed to answer these questions. Currently, no evidence-based tools exist to support sound decision-making when managers are deciding whether to adopt new technologies, which makes it challenging for long-term care homes to successfully adopt technologies that can support both the residents and the staff members. In this SSHRC-funded research project, we will explore the factors that support sound decisions about implementing new technologies in long-term care homes. This research is particularly important since the number of new technologies developed and offered to homes across Canada continues to grow, along with the number of managers forced to make decisions about which technologies are best for their residents and staff. This research will lead to a structured way of making decisions and guide the interaction between technology developers and managers of long-term care homes. It can also inform planning and future policies that aim to facilitate the implementation of technology in these homes.